Well, hi everyone, virtually, and hello. Thank you so much for joining today. This side event session is on climate change and mental health. And I also want to thank the Planetary Health Alliance team for making this event happen. I also want to take a moment to respectfully acknowledge that today I'm giving this presentation on the traditional land of the Massachusetts people who have been stewards of this land for generations. I extend my respect to the people of Massachusetts and the neighboring nations who live here today and to their ancestors who have lived here for generations before. This session is focused on climate change's impacts on mental health, and I'm going to be specifically discussing the findings from the updated Mental Health in Our Changing Climate report, co-published by ecoAmerica and by the American Psychological Association. So during this session, I'll start with a brief introduction about who I am. I'll go over the report in more detail, dive into context of mental health and climate change, the impacts of climate change on mental health. We'll talk about inequities, solutions, and then we'll have hopefully about 15 minutes at the end for questions and answers. And I also want to add that in this discussion, some sensitive topics, including suicide and sexual assault, will be briefly mentioned on the slides. And so I give that as a warning and as an opportunity for anyone who doesn't feel comfortable to switch sessions at any point. It is entirely acceptable to leave. Okay, so I always think it's a bit easier to listen to these presentations when you know who's talking to you. My name is Nicole Hill. I'm the Research and Marketing Manager at ecoAmerica. And actually way back when I was in my first year of undergraduate study, I was just starting to get interested in climate change and health, and I found the Planetary Health Alliance online, and I volunteered to help code some of their research articles and their bibliography on their website. So it's really exciting for me to be here. It feels like coming around full circle, and I'm just happy to be at this meeting for the first time. Anyways, like I said, I work for ecoAmerica, and ecoAmerica is a nonpartisan, nonprofit organization working to build institutional leadership, public support, and political resolve for climate solutions in the United States. We do that by engaging trusted messengers that Americans look to for guidance and direction, including and importantly the health sector. And in my role, I primarily work on researching climate attitudes on and how they change over the years. During my time that I was studying public health in graduate school, I felt like mental health was really starting to be recognized as a critical component of public health. But I remember when I started taking my climate change courses, it seemed that the discussions were really centered around the physical health impacts, not as much the mental health impacts. And so I hope that this presentation today really glues together that connection for everyone, because it is an impact of climate change that we're seeing now and is impacting people in the United States and across the world. Here is the report for reference. I do hope to get to everyone's questions at the end, but if we don't, the report is a great resource to look for answers. And on this pulled out inside page of the report, it might be hard to read everyone's names, but I want to acknowledge and thank my co-authors, Dr. Christy Manning, Dr. Susan Clayton, and ecoAmerica's Executive Director, Megan Spicer. And I also want to thank all the contributors and the peer reviewers of the report as well. Okay, so now I'm going to offer a little bit of context before diving into the explicit impacts of climate change on mental health. So I think it's important that I provide an overview of the links between physical, mental, and community health. And you can actually find this graphic that you see on the screen here on page 16 and 17 of the report if you choose to read it later. The important message here is that while climate change directly impacts physical, mental, and community health, we need to remember too that they're all interconnected. So individual mental health is connected to our physical health impacts our mental health, and community mental health is influenced by both. This image also illustrates that not all Americans are affected equally. There are certain people who are made more vulnerable. But to illustrate, imagine that you're a person with asthma, and as our climate changes, you'll experience more frequent asthma episodes, and this can cause stress and anxiety. And because your activities are more limited, it can also lead to depression. And given the rise in incidence of asthma overall, not only you, but other people in your community may be experiencing the same symptoms. So understanding the interconnectedness can help us better plan to protect our mental health as our climate changes. And it can also help us create more effective climate policies that consider mental health and well-being. Another aspect of climate change and mental health is who has access to decision making. So for example, if you live in a community that's experiencing disinvestment, or perhaps you are too young to vote, but not too young to see and understand what is happening to the climate around you, you might become frustrated and isolated if you can't influence that systemic change. So not to jump too far ahead to the solution section of the presentation, but I encourage you to think about the ways in which you solicit and incorporate community feedback into your climate actions. So many reports are showing a rise in concern about climate change amongst Americans. ecoAmerica research found earlier this year that 75% of Americans were concerned about climate change, with 45% being very concerned. Yet only 51% of Americans believe that others around them are also concerned about climate change. And actually, when comparing this to a few years ago, we saw a gap in the actual versus perceived concern grow. So previously, 45% of people said that they were concerned, but 23% said that 45% said that they were very concerned, but 23% thought that others around them were very concerned. Now that's down to people thinking that only 14% of those around them are very concerned about climate change. So 3 times as many people are very concerned than people actually think. And that gap in actual versus perceived concern could be contributing to silence on the issue, because people feel alone in their concern and might be afraid to step outside of their group's norms. This is called pluralistic ignorance, and it's a psychological barrier to action on climate change, which I will dive into on the next slide. So while most adults in the United States express concern about climate change and a majority favor efforts to ensure that we have a sustainable planet for future generations, it hasn't yet translated into the personal and the political action that's necessary for solutions that are at scale. So there are several psychological barriers that hold back action on climate change, and these include psychological distance, which refers to the idea that climate change is a distant worry. It's something that is going to happen to others at a later date, but perceived as something that's not going to harm you right now. And even though concern is really high, only 45% of Americans say that they're personally at risk of harm from climate change. So the sense that climate change is a distant problem creates a barrier to personal and to public engagement on the issue. Belief systems also play a huge role in how we think about climate change. Many proposed climate solutions, such as large-scale government programs, conflict with political worldviews that prioritize limited government power. So this explains in part why a conservative political identity, just for example, has become a predictor of climate change skepticism. Then we have pluralistic ignorance. As noted, it's the idea in which people's ideas about what a group thinks can differ from what group members truly believe, and that can inhibit acknowledgement of a problem. And then fractured hope. So those who lack hope that climate change can be fixed and believe that there's no way the climate crisis can be solved are actually less likely to take action on the issue. It's important in proactive response to believe that solutions work and that climate change can be addressed. And so fractured hope can get in the way of that action. And then finally, the need for efficacy. Studies suggest that we need to both believe in ourselves, that we have the ability to take necessary actions that would be self-efficacy, and that those actions will result in helping solve climate change, that would be outcome efficacy. So the good news with all of this is that these barriers can be overcome with visible leadership and action on climate by people Americans know and trust in their daily lives. One study found that people were far more likely to get involved in public sphere action, such as donating money or contacting their policymakers or attending protests, if they believed that their social group was also participating. Visible leadership and action from health professionals, and I'm kind of jumping to the last bullet point here, but that can prove to be very helpful. Just last year, 68% of adults in the United States said that they trust health professionals as a source of climate change information. And then personal experience with impacts, or better yet, personal experience with solutions. People are feeling the effects of climate change today, and often after experiencing an extreme event, it'll stay salient in their mind. So people in the United Kingdom who had experienced severe flooding events not only felt more at risk from climate change afterwards, but also expressed greater support for policies that address climate change. And then finally, helping people see the connection between climate and their family's health, both on the impacts of climate change, but again, better on the solutions to climate change. Providing information about the personal health benefits of specific climate mitigating disasters can lead to greater expressed willingness to adopt those behaviors, such as replacing driving with other forms of transportation or eating more vegetarian meals. And then talking about these connections doesn't necessarily need to center around climate change or even the classic language we use when talking about climate change. Discussions can focus on talking about the specific impacts like hurricanes or heat waves that might be less politicized. Okay, so for the slides coming up, I'm going to briefly summarize some of the information from the report on mental health impacts of the climate crisis. And then I'll start with severe weather and move to the slower, more chronic impacts of climate change. And then we'll briefly talk about climate anxiety, which you may have heard of before. The term has received lots of traction recently. Okay, so because of climate change, the number of severe weather and disaster events is climbing each year. Between hurricanes, flooding, extreme rainfall events, wildfires, and other impacts, there's really hardly a region of the United States that has been left unaffected. These events can have real personal impacts that can harm mental health, including trauma and shock. Directly from extreme events, this can occur through personal injury or injury of a loved one, loss of personal property or loss of pets, loss of livelihood. PTSD rates are found to be as high as 30 to 40% among disaster-exposed people, and it can last for years. And other impacts include anxiety, depression, increased stress-related physical health problems, strains on social relationships. So within households, psychological distress can have serious consequences, with a number of studies finding that violence in the home, including domestic abuse and child abuse, often increases in families who have experienced disasters. There's also impacts on communities. Experiencing an extreme weather event can uproot communities and weaken its social ties. At a minimum, people may be temporarily displaced and unable to experience their usual social interactions. And this is important because a supportive social context is strongly associated with both our physical and with our mental health. And without these social connections, people are increasingly vulnerable to stress. Experiencing a disaster so intense that someone might need to leave their home and community is particularly traumatic. And displacement is linked to higher rates of PTSD along with negative mental health outcomes such as anxiety and depression. Losing one's community either because it was destroyed or because of displacement threatens people's sense of belonging and threatens their sense of identity. So people are sometimes not aware that the chronic impacts of climate change are also very dangerous. For example, extreme heat is one. Extreme heat can be deadly. Heat affects our mental health because it's both a physiological and a psychological stressor. Increased temperatures are linked to mood and anxiety disorders, schizophrenia, and vascular dementia. Increases in mean temperature are also associated with greater use of emergency mental health services and increased levels of suicide. The causal mechanism here is still unclear. There's probably multiple ways in which heat impairs mental health. Overall, higher temperatures are simply an additional source of stress that can overwhelm coping abilities for people who are already psychologically at risk. Then on to drought. So drought causes psychological stress, and the changing patterns of precipitation that are associated with climate change include increase in drought. Some of the psychological distress associated with drought include generalized anxiety and depression. Particularly, this has been studied for farmers and farming communities and people who are economically affected. For farmers, drought can be a multi-dimensional threat, and these threats include increasing workload while reducing the likelihood of having a good crop, raising the risk of financial hardship, and causing uncertainty about the future. It may also decrease the availability of food and water, create a sense of shame and humiliation due to perceived failure. Prolonged drought has been linked to farmer suicide around the world. Factors that contribute to climate change, particularly the burning of fossil fuels, also contribute to air pollution, such as increased particulate matter. Air pollution can increase the risk of anxiety and other mental disorders. It impairs cognitive function, and it predicts lower ratings of happiness and life satisfaction. There's evidence as well that air pollution has long-term impacts on children's cognitive development and their mental health. And we'll get into, there's a slide about impacts on children specifically a little bit later on in the presentation. Finally, another way that these chronic impacts of climate change affect people's mental health is by changing the places that people live so dramatically, either through sea level rise, for example, or through species loss, that people lose their sense of place, they lose their sense of place attachment, and even to some extent their sense of self and identity, as well as having control over their lives. People experiencing loss of place often experience grief, emotional pain and disorientation, and loss of place is not a trivial experience. Many people form a strong place attachment to the place where they live, finding it to provide a sense of stability and security and personal identity, which are really threatened when that place is lost. Climate change threatens identity in other ways too. Because severe storms and high temperatures disrupt economic activity, climate change may have an effect on occupational identity, which has been associated with increased risk of depression. Climate change also has the potential to disrupt expectations and habits that are learned over the years, as well as intensifying certain daily life inconveniences, which can have impacts on individuals' sense of autonomy and their control. Exposure to unwanted change in one's environment can also reduce an individual's sense of control over their life, which may limit the ability to cope with daily stressors and lead to increases in stress and anxiety, even a feeling of reduced self-esteem if people feel that they're less competent. So in addition to the individual impacts, the chronic impacts of climate change can also have community-level outcomes. One of these is loss of culture and loss of tradition, and this has particularly been studied in cold climate indigenous communities that have been affected by the rapidly rising temperatures. Indigenous peoples often report a strong attachment to the land, even a sense of relationship to it, and so it can be important to traditional practices and foods. And warmer temperatures due to climate change prevent some of those long-standing cultural practices. Members of the Inuit community said that they had noticed changes in the local climate that were linked to sadness, anger, increased family stress, and a sense of diminished self-worth and community cohesion. A second community-level outcome is increase in hostility and conflict. For example, violence may increase when competition for scarce natural resources increases, or when eco-migration brings formerly separate communities into contact and they compete for resources. Rising temperatures are linked to interpersonal aggression and violence, including domestic violence, assault, rape, and even murder. And growing evidence suggests that climate change may be a contributing factor to intergroup violence, such as political conflict and war. Okay, so on to climate anxiety. Can I get a show of hands of people who've heard of climate anxiety? It's received a bit of traction in the news recently. Newspapers and magazines that traditionally don't talk much about public health or climate change, like Elle, Teen Vogue, have started writing articles about climate change or climate anxiety. So it's definitely making a name for itself. Even among people who have not experienced the direct impacts of climate change, simply knowing that it exists and having a sense of the problem can be accompanied by negative emotions, which include fear, anger, feelings of powerlessness or exhaustion. In a 2020 survey by the American Psychological Association, about 2/3 of respondents said that they felt at least a little bit of this kind of anxiety, and about 1/4 of them said that they felt a lot of this type of anxiety. Negative emotions about the climate crisis do not constitute mental illness, but watching the slow and seemingly irrevocable impacts of climate change unfold and worrying about the future for oneself, for someone's children, for later generations, that can be a source of stress and sadness, which is referred to as climate anxiety. It does appear to be more prevalent among younger adults, and international research shows that negative emotions about climate change are associated with lower mental health. So it's important to note that while the destructive impacts of climate change will be felt by everyone in some way, the burdens of climate change are going to fall and have previously fallen most heavily on those oppressed by historical and present-day social, economic, and political power dynamics. Climate change is a real destabilizer. It's a destabilizing force, and it exacerbates pre-existing socially determined vulnerabilities, making some populations more prone to mental health difficulties. For example, one of these groups is people who are economically disadvantaged. Living in poverty is a real risk factor of its own. It's linked to poorer mental health, greater likelihood of being a victim of crime or another form of violence, and higher risk of depression and anxiety. Individuals with serious mental illness may also be more likely to be unhoused and less likely to regulate their own behavior in response to dangerous environmental conditions. And then add this to the fact that economically disadvantaged people are more likely to be exposed to a disaster because poverty pushes people to live in areas with higher disaster risk. And then in the aftermath of disaster, people with lower wealth have less access to the material resources that help people cope and recover from that disaster. So all of these factors contribute to the higher risk of stress, depression, and anxiety experienced by economically disadvantaged people after a disaster. Discrimination and systematic racism in the United States expose racial and ethnic populations that have been marginalized to a wide array of environmental risks while simultaneously denying them access to the financial and the political resources that could help buffer some of those climate change impacts. One stark example of this is how historical discriminatory housing policies, such as redlining and racially restricted covenants, have forced people of color to live in dangerously heat-prone areas. Formerly redlined neighborhoods in the United States tend to have lower tree cover. They tend to have less green space and more concrete, which makes them significantly hotter. And this not only increased the health risks from high temperatures, but it also deprives these communities of the mental health buffer that comes from having urban green space. Disinvestment in urban areas with high concentrations of people of color has led to outdated infrastructure, such as inadequate warning systems, poor flood preparedness, clogged and deteriorating storm systems. And these infrastructure failures expose residents to more of the physical health impacts of climate change, which then in turn makes it more likely that their mental health and well-being will be affected. All of these factors put a heavier burden on Americans of color, making them more susceptible to depression, anxiety, and the psychological distress brought on by climate impacts. Indigenous communities threatened by climate change are found around the world, including in Alaska, where villages are vanishing because of permafrost thaw, and in the Gulf Coast where the shoreline is eroding. Being forced to relocate because of climate change, or even thinking about relocating because of climate change, causes significant stress. It can weaken social connections and increase levels of conflict within the community. Climate change threatens Indigenous ways of life in numerous other ways as well. Indigenous persons and cultural identity is often directly tied to the land through history and through lived experience. And so when that land is irrevocably altered, it deeply impacts those who are connected to the land. Shifts in climate and weather affect Indigenous communities' food security too, and their traditional culture practices, and also their attachment to place. So it's not surprising, but still is extremely troubling that recent systematic reviews of the research indicate that suicide, depression, and anxiety among Indigenous peoples in North America are linked to both acute and chronic weather events. And then children. So nearly half of the world's children, which is about 1 billion children, currently live in countries that are considered to be at extremely high risk to the impacts of climate change. There's no question that experiencing an extreme natural disaster or having to be displaced from one's home exposes a child to high levels of stress, and this has lifelong ramifications. It can affect the development of neural pathways in ways that impair memory, executive function, and decision-making later in life. It can result in higher levels of anxiety and depression. Climate change-related disasters will affect children directly through the stress and trauma of an extreme event, and some studies find that children experience PTSD to a greater degree than adults do. Climate change will impact children in less direct ways as well. For example, their schooling may be interrupted. They may also be impacted by the vicarious experiences and mental health of their caregivers. And additionally, food insecurity is exacerbated by climate change, and malnourishment during earlier years is associated with later behavioral and motor problems, lower intelligent test scores, fewer years of schooling, and reduced economic activity. Children are especially vulnerable because often they have to rely on others. They rely on their parents, their caregivers, social connections in their community to take care of them and to really ensure their well-being. And research that one of my co-authors, Dr. Susan Clayton, was involved in shows that young people around the world are experiencing climate anxiety, which we just went over. They feel that adults and governments in particular are failing them by allowing climate change to threaten their futures. And then some additional populations that are made vulnerable to the mental health impacts of climate change that I don't have time to dive fully into today, but they are outlined in much more detail in the report, include elderly people, in part because physiologically they're less able to withstand heat, and because, like people with a disability, they often rely on services that become unreliable or unavailable during extreme events, such as mobility services. Women are also harder hit by climate change, in part because they tend to have greater caregiving responsibilities. Extreme weather events are also associated with an increase in intimate partner violence against women. And people with pre-existing mental health diagnoses are more at risk for a number of reasons, including the fact that some medications for mental illness can make people more susceptible to heat. And then finally, in a report, we describe the significant risk faced by outdoor workers. Briefly, we mentioned farming communities, but there's more detail in the full report. So while the impacts of climate change on mental health are profound, solutions are abundant and they are accessible. Mental health benefits to climate solutions include improved mood. They include cognitive function, academic performance, sense of control and agency with one's life. The list goes on, reduced stress, and so forth. We can each prioritize our own mental health as we work to address climate change. Here are some suggestions for building resilience in individuals specifically, and each one of these is described in greater detail in the report. These ideas are meant for individuals who want to bolster their own personal capacities, and they're also helpful for mental health or other professionals who support others in building their personal or their household resilience. So a few of them are building belief in your own resilience, fostering optimism and hope, cultivating active coping and self-regulation, bolstering interpersonal sources of support, encouraging connection and care for children, finding a source of personal meaning, boosting personal preparedness, and then, when health and safety allow, upholding connection to place. As mentioned on the previous slide, how important it is how important place attachment is. Okay, so individual efforts alone, while they are important, they're insufficient. So we're going to move from individual resilience onto community resilience. And a strong community can be a source of stability and safety for its residents. All humans fare better when they perceive the world around them as orderly and predictable and benevolent. And as we know, an individual's ability to mitigate disaster risk is profoundly shaped by policies and decisions made by those in power at the community and local, at the state, and at the federal levels. And so with that in mind, we've put together this set of suggestions for how communities can create conditions that make life better for everyone, and in particular those who have been made most vulnerable in the past. So this includes steps like expanding response and resilience plans, addressing inequities, strengthening mental health services, updating physical infrastructure, and developing an effective warming system. And like I said, each one of these is explained more deeply in the report. So while resilience efforts are necessary to protect people and communities in the face of climate change, they do fall short in addressing the problem at its root. Rapid and just transitions to clean energy and transportation and infrastructure and agricultural practices are critical at all levels of government and all levels of operation. And we need to invest in research, mental health services, disaster support for organizations and government agencies with mental health climate programs. And the U.S. really has the ability to do this. We have the competency for a just and an equitable transition at scale, and we can do it in the timeline necessary. So this cartoon on the screen pokes fun at the quote, we agree, let's see what it says. We agree to sign a pledge to hold another meeting to consider changing course at a date yet to be determined. And while this is supposed to be comical, it does ring true. Success is going to depend on the commitments and on the investments of policymakers, innovative companies, resourced nonprofits, and of course advocates. And world leaders right now are being pressed to accelerate their commitments and their actions, especially as we lead into COP next week and with midterms right around the corner too. So we can all be pushing our elected officials. Local climate solutions are also within reach. Meaningful local climate solutions are within reach. Communities can take thousands of actions on climate that benefit mental health, and so these are just a few ideas to get started. You can inspire change by making a public commitment to climate solutions and feature it online and in all of your communications. Focus on the benefits and the cost savings that people in the community will realize with solutions and how investing today will make the community stronger tomorrow. Aim for quick success with easily achievable and affordable steps that can be put in place quickly. Establish priorities and make informed plans with goals for energy efficiency, renewable energy, electric and active transportation and mass transit, waste reduction, and so forth. Engage and communicate with leaders in business, education, mental health, and faith, those who are already making commitments to climate solutions in ways that are not politicized. Embed solutions and recycle the savings. Climate and sustainability solutions should be part of ongoing business and local governments rather than being offload as a separate project. It should really be weaved into already occurring plans. And then build on and adapt to results. So these plans can always be adjusted. They should be livable. They should be adjusted as new opportunities arise. All of us, individual people, can take tangible actions at home and in the community to help mitigate climate change and prepare for its impacts. These actions, in turn, can provide a greater sense of security and self-efficacy. Examples include having an emergency plan for you and your family, creating an emergency kit with some meaningful personal items included, understanding your own medical needs, so writing them down and then also including that in the emergency kit. Bolster your health and well-being by learning new resiliency skills, staying physically active, and sharing concerns with others, and actively reduce your own climate impact. And we all have more power than we think we do to affect progress at the community level, so we don't need to wait for someone else to engage. We are the ones that we've been waiting for. We can be the ones we've been waiting for. A good baseline is to develop and maintain social connections with your neighbors and with your community members. Discuss with them the benefits of solutions to health and the other benefits with climate solutions. Support policy and solutions with advocacy, letting your elected officials know that you expect ambitious solutions from them. And you can bring people together for collaboration or for a community resilience project, or you can join one that's already existing within your community. And then for those of you who are able to, voting, it's right around the corner. Okay, so this slide says what health professionals can do, and it really can be applied to all people who work in the health space because your voice is so important, and as health leaders, your community really looks to you for information and for advice. So you can become a climate literate professional, which I'm sure many of you are at the Planetary Health Alliance meeting, and stay up to date on climate change and the impacts on mental health like you're doing right now. And there's so many sessions. It was very exciting to see sessions on mental health and climate change this morning and more to come in the next few days. But the first step in climate leadership starts with literacy. Start by learning how climate change impacts mental health and the ways to protect it. And then engage other health and mental health professionals to share your knowledge or collaborate with them on programs and research. Climate leadership can extend to fellow mental health professionals and fellow mental health colleagues, many of whom are just as concerned as you are and might really appreciate it to be invited to engage on the issue. Be visible and local leaders within local communities by giving talks, participating in events, or serving on planning committees for resilience or climate action plans. Individuals in the health and planetary health community really have a respected platform to influence and mobilize climate change discussions. Support national and international solutions, again, thinking about what you can implement and building on that for large-scale systemic change. Health and climate experts are trusted professionals who have the power to influence policy at all levels of government. And then finally, I want to leave you with some resources. So these are listed in the report, and they're hyperlinked in the online version. The full report is free, and it's available to anyone who wants to read it on ecoAmerica's website. If any of you are particularly interested in this topic, I actually have a few hard copies up here, so I would love to meet you at the end, and feel free to take one. Some resources for individuals include Coping with Climate Change Distress, which is a tip sheet that provides coping strategies that have been identified by social scientists. There's 4 categories of strategies provided, and those include behavioral, relational, cognitive, and emotional. The Climate Resilience Network is actually based in Tasmania, Australia, and it's a network of mental health professionals. On their website, you can find tools and resources for building resilience in our changing climate. Project Inside Out is an online informational resource and forum that brings together activists and clinical psychologists to drive behavior change. And then Good Grief Network is a 10-step program for resilience building, and they also provide social and emotional support to people who are feeling overwhelmed by the state of the world and our changing climate. And it provides a place for people to connect with community, to share vulnerability, and to process some of the heavy emotions that are coming out of climate change. And then Facing It is a podcast by Dr. Jennifer Atkinson, and she's a climate educator and researcher who works with students and communities to channel despair into action. The podcast explores emotional burden of climate change and why despair leaves so many people feeling unable to respond to the threat. And then the series introduces ways in which we can move from despair into action by addressing the psychological roots for our unprecedented ecological loss. Here are some supportive resources for communities. So the Building Resilience Against Climate Effects, also known as the BRACE framework, is a 5-step process that allows health officials to develop strategies and programs that help communities prepare for the health effects of climate change. The Community Emergency Response Team, or CERT program, educates volunteers about disaster preparedness for hazards that might impact their area, and then it trains them in basic disaster response skills, such as fire safety, light and search rescue, team organization, and then some disaster medical operations. Public Health Adaptation Strategies for Climate Change is from the EPA, and it illustrates ways that communities can address anticipated, current, and future climate threats to public health. I believe that they also use the BRACE framework in their recommendations. The U.S. Climate Resiliency Toolkit can help people document climate hazards that could harm the things that they care about and decide which situations you most want to avoid. It also helps you come up with workable solutions that reduce your climate-related risks. The Climate and Traditional Knowledges Working Group is a group of Indigenous persons, staff of Indigenous governments and organizations, and experts with experience working with issues concerning traditional knowledges. And the work group has created guidelines for considering traditional knowledge in climate change initiatives. And then finally, before we wrap up, I want to leave you with some ecoAmerica resources that health professionals might find helpful. ecoAmerica teamed up with some national partners, including the Planetary Health Alliance, to provide resources including guidance on how to best engage patients, peers, and your community and policy makers in climate action. So that's the Moving Forward guide, the first bullet. And this guide is primarily for health professionals at clinics, at small healthcare practices, professional associations, and at local health departments who want to lead on climate and sustainability. It complements other resources available that are for hospitals and hospital systems too. And then Let's Talk Climate is a series that provides guidance and support to climate activists as they seek to expand effective climate solutions. The series features topics on nature and science, on faith, communities and local community governments, politics and people. And it rotates in weekly sessions on Thursdays. You can find all of the Let's Talk Climate episodes on YouTube, and then there's new live episodes that come out occasionally as well. And this is really meant to provide empowering information from leaders in the health, faith, and local community sectors. We also provide climate action fact sheets that offer information and guidance on what you need to know and what you need to do about climate change. And these 2-page resources can be used as guides and handouts with your family, with your friends, colleagues, and community. And you can see there's a wide range of topics, and ecoAmerica is working to produce more as well. And then one item that's not listed on here, but I still want to mention, it's a newly launched initiative that my colleagues are very excited about called Climate RX. And it's specifically for health professionals who work directly with patients, and it provides a non-interruptive way to open up the conversation with patients about climate change and their health. It involves wearing an optional pin or an optional badge that lets the patient know they can ask you about climate change if they would like to. So if any of you work directly with patients and want to learn more about that program, please come introduce yourself afterwards, and I would be happy to give you the contact information for some of my colleagues that are more involved with Climate RX. And then just before I take questions, I want to take one more moment to thank my colleagues again and my co-authors on this report, Megan Spicer, Dr. Susan Clayton, and Dr. Christy Manning, who worked so hard on compiling this research and putting this report together. And then I also want to thank Ben Fulgencio-Turner, who's the director of ecoAmerica's Climate for Health program, for his support with this presentation too. And that is all I have for today.